Welcome to the Contrary. I'm Bonnie Erbé. As the Covid-19 pandemic continues, we're focusing on the impact of vaping and smoking on efforts to curb the disease and whether these habits put people at a greater risk of a negative outcome if they do get the novel coronavirus. We're speaking with experts in the field. Up first, we begin with Stanton Glantz, professor of medicine and director of the Center for Tobacco Research Control and Education at the University of California, San Francisco. Hello, Dr. Glantz.
Hello.
Tell us about the research you've conducted into the effects of e-cigarettes and vaping.
The way a cigarette works is you set the tobacco on fire and that generates an aerosol of ultrafine particles that carries nicotine, which is the addictive drug in tobacco, down deep into your lungs where it's absorbed. Now, when you set the tobacco on fire, you get a lot of bad chemicals in the combustion products. And so the idea of an e-cigarette is you generate an aerosol of ultrafine particles to carry nicotine down into your lungs by heating up a liquid, so you don't have all the bad combustion products. And the argument was, well, without the combustion products, e-cigarettes are going to be a lot safer than a cigarette. We've been studying the effects of e-cigarettes on heart and lung disease, and what we found is that while the exact nature of the chemicals that you're inhaling with an e-cigarette are different from a cigarette, the overall effect is about the same. Also, there's research not done by us, but others showing that the flavoring agents in e-cigarettes, many of them are highly toxic to your lungs and your cardiovascular system.
Please tell us about EVALI. What is that and how does it play into the COVID epidemic, if at all?
Well, EVALI stands for e-cigarette and vaping induced lung injury. And last summer, there were a spate of mostly young people getting very severe lung illness from using e-cigarettes. One of the causes of EVALI that's been identified is a chemical called vitamin E acetate, which is used in a lot of marijuana or THC e-cigarettes. And this is an oily substance, and the little tiny oily droplets, these microparticles of oils carried into the lungs by the e-cigarette aerosol, clog up cells called macrophages, which are cells deep in your lungs that gobble up viruses and bacteria. And the clogged up macrophages stop working and not only don't gobble up the viruses and bacteria, but they actually start blocking your lungs.
Your group, the Tobacco Centers of Regulatory Science, have now become part of the FDA?
FDA, working with the NIH, has funded 9 big research centers around the country called the Tobacco Centers of Regulatory Science, or TCORS. I'm the principal investigator of the one here at UC San Francisco. So they're funded by the FDA, but we're not part of the FDA. But we meet with them monthly and try to produce research that's going to help inform tobacco product regulation, but we're independent. In fact, we've probably put in 50 or 75 public comments to the FDA criticizing them for inaction on e-cigarettes, inaction on flavors, and we think that their recent approval of IQOS, which is a heated tobacco product by Philip Morris, probably broke the law.
And tell me, please, what is it that you have produced when it comes to vaping and teenagers?
We've shown that teenagers, a lot of them, don't know that there's nicotine in e-cigarettes and that it's addictive. That they perceive them as being less risky than cigarettes. We've done a lot of work. In fact, this is something I've personally done, showing e-cigarettes are a gateway to cigarette smoking for kids. And about 3/4 of the kids who start nicotine use with e-cigarettes, if you look at their risk profile in terms of their psychology and demographics, you would predict they would never pick up a cigarette. We've also done a lot of research working in the tobacco industry internal documents. We have almost 100 million pages of previously secret tobacco industry internal documents. And we've really been able to go back and see, like, why did the tobacco companies develop e-cigarettes in the first place? And it was not for harm reduction or to help people quit smoking. It was to hold on to smokers, because what they found was a lot of people were quitting smoking and they wanted to develop alternative products that people would perceive as safer, even though the industry never demonstrated that.
Expert on vaping and smoking, do you believe particularly vaping, e-cigarettes have played any role in expanding the transmission of COVID-19?
I don't think that cigarettes or e-cigarettes per se expand the transmission of COVID-19. There's only been one study that I could find that looked at this question. It looked at it in the context of influenza and asked whether the amount of flu virus exhaled by smokers is different from the amount of flu virus exhaled by non-smokers. And the smoking itself didn't make any difference. Now, there might be some indirect effects. For example, you cough more if you smoke or vape, and that would expel more virus. You have more hand to mouth activities, which would probably promote transmission. But if you ask the question, does the fact that you're inhaling this aerosol of of tobacco smoke affect the amount of virus that gets exhaled on a breath? The answer to that, again, just based on one study, but it seems to be no.
A lot of the public don't realize, although it has been reported, that many of the people who get through the virus itself sustain severe lifelong lung problems. So, would a person who vapes be, be predisposed to not being able to fight off the virus as well as somebody who doesn't?
We published a paper just recently where we looked at the world literature on the question of, does smoking affect disease severity among people once they get infected with COVID? And what we found was that if you're a smoker, it about doubles the odds that you'll get severely ill, defined in a variety of ways. And the reason for that is probably because smoking depresses your immune system. It triggers inflammatory processes and it puts your body in a position where it is more susceptible to infections and can't fight them off as well. So for smoking and COVID disease progression, there's now actually quite a sizable literature which shows that smoking makes COVID disease progression worse.
Thank you, Dr. Glantz. Now we are speaking with Dr. Humberto Choi of the Cleveland Clinic, and you, as a pulmonologist, worry that the symptoms of vaping lung injury may mimic those of the coronavirus. Please tell me about that. Why is that?
Something that we learned from the outbreak that we had last year of electronic cigarettes and vaping causing acute lung injury is that we had a lot of young people who were vaping and were presenting with shortness of breath and low oxygen levels and acute respiratory failure, and some of them require mechanical ventilation. And this is a very similar presentation that COVID-19 can present, especially in young people, because the symptoms can be very nonspecific.
And I remember a bunch of young people died. I believe it was in Wisconsin, and there were deaths, not just injuries and not just going on artificial lungs, but deaths from vaping, correct?
Yes, and this was across the country. I think this was first identified in a cluster of cases in Wisconsin and Illinois. But there were cases all over the country, and there were cases severe enough that require life support, require mechanical ventilation, and there are dozens of deaths related to that acute lung injury from vaping. Last year, one of the studies showed that there was actually the e-liquid that contained vitamin E was one of the responsible substances that was causing acute lung injury. Now, it is more prevalent among young people and high schoolers just because that's the demographic that was using electronic cigarettes more often than others.
Is the coronavirus one that seems to attack the lungs more than, say, the Hong Kong flu did, or SARS, or any of the other pandemics that have taken place?
All these other viral infections, they primarily cause more lung injury. Now, the coronavirus specifically is concerning because one of the ways that the virus can affect the lungs is by attaching itself to some receptors that are in the lining of the airways and in the lungs. And that kind of receptor seems to be upregulated by smoking and possibly by vaping. So one of the hypotheses is that smokers and people who vape could be at higher risk of contracting the infection compared to people who don't smoke. Again, this is speculation, but this is definitely one of the things that we are looking into, and hopefully soon we'll learn more.
Do you think there should be more of an emphasis by the media on the possible impact of secondhand smoking on transmission of COVID?
Now, how COVID-19 affects smoking, or how the smoking affects how the course of the disease is, this is still unknown. So I think right now we need to find a lot of these answers first before we have a more open discussion about this. But I'll say every time is a good time to talk about, when to quit smoking and vaping.
Is it more likely that somebody who smokes or vapes, is that person more likely to contract COVID? Do we know anything about those numbers yet?
There were some small studies that were primarily coming from Asia that were showing that there maybe men who smoked were more likely to acquire this infection.
But why men more than women? Is there some hormonal difference that could make men more susceptible?
Yeah, this was not very clear, but at least in those studies in Asia, the difference was mostly from smoking, because in Asia, the prevalence of smoking is much higher in men compared to women.
Are there issues that people should pay attention to, whether it be COVID-19 or another pandemic, that they might not be aware of symptoms that are associated with the virus?
Something that is interesting that we are learning now in this pandemic, that are a lot of symptoms that were not recognized before, and we are recognizing now. For example, the loss of the sense of smell, or the appearance of what people call the COVID toes. These are all new signs and symptoms that we're learning more. And now during a pandemic, when there was a question whether this is related to the disease or not, I think the best thing is really to try to reach out to a healthcare provider and get tested if possible, and see if maybe that had any connection to the infection.
What are we finding about people who survive the virus? Are any of these effects that they get, like loss of lung capacity, lifelong? Do they have to live with that for the rest of their lives? The loss of taste? Do they get all their senses back? Do they get all their capacity back when they're done, or are there lifelong impacts?
Good question. And how much this infection can leave a long-term disabilities or injuries in the body, it does depend on how severe the infection was. What I'm hearing, that most people are recovering their sense of smell, but in terms of lung function or how weak or strong they get after infection, it does depend on how severe the illness was. For many patients who end up being admitted in the intensive care unit, who require mechanical ventilation, and especially when that happens for a prolonged time, they might not be the same person as they were when they went to the hospital, and they may be discharged very weak, so they may need rehabilitation, physical therapy just to get their strength back. Now, some people might be so weak that may need mechanical ventilation for a prolonged time and even a tracheostomy, but that depends on how someone is after this illness. Not necessarily everyone will have a long-term disability because of that, or have loss of their lung capacity because of the infection. Just like when someone has an infection from other viruses or a pneumonia, there might be that period that the lung function is not as good as it was before, but it will tend to recover, especially when the infection is more mild.
Having had a tracheostomy, which destroyed one of my vocal cords, do you think that, which is a serious problem, it reduced my breathing capacity in half. Do you think most of the public understands how serious intubation is? I mean, they hear the term intubation on TV and the news, read it online, but do they realize that that's a serious surgery that can cause permanent damage?
Yes, it is a very serious thing, and this is not a decision that anyone takes very lightly when we recommend intubation, mechanical ventilation, or even a tracheostomy to someone. Although it does have possible side effects or complications like any medical procedure, it is part of the treatment, and sometimes a tracheostomy or a mechanical ventilation, even when required for a prolonged time, it might be also part of the recovery.
Thank you so much, Dr. Choi. Now we are switching to executive producer Carrie Stein, who spoke with Dr. Susan Walley. She is a pediatrician and professor at the University of Alabama.
Thank you. Tell us a little bit about your background and why understanding tobacco, especially among teenagers, is important.
I'm a pediatrician who focuses on the inpatient setting, so I'm a pediatric hospitalist, and early in my career, I noticed that so many of the children that I was caring for were in the hospital with diseases that were either caused by or worsened by tobacco smoke exposure, like secondhand smoke. And so that really got me passionate about working in this area, and also really being a resource for these parents who were smoking and love their children very much and want to quit, but didn't have access to cessation resources.
How has vaping evolved since being introduced mainstream?
That's a great question. E-cigarettes, or vape devices, were introduced in the United States around the mid-2000s. I have kids that are in that age range, and to think that, in middle school, 1 of 10 of those students, and in high school, 1 of every 4 are considered current users is so concerning to me. The second is that there has been significant evolution in the technology. When e-cigarettes first came on the market, this is a blue cigarette, and many people would call them ciga-like because they look very much like a cigarette. Although they're a different color, they had a similar shape. Now those have evolved from this ciga-like to this, which is more commonly thought of as a vape pen. And the thing that I want to call your attention to is that you can put your own e-liquid in this, as well as other substances, particularly in youth. We know that youth are adding things like THC, otherwise known as marijuana, and other illegal substances. So it evolved from these vape pens to this is something called a mod, or a tank system. And as you can see, they're bigger. They don't look like cigarettes anymore. They have a larger refillable container for that e-liquid. And then you can also adjust the voltage and the wattage. Users feel that they have a more individualized experience. And then what our youth primarily are using are these products known as Juul. And Juul, we will say, is like the iPhone of e-cigarettes. That technology is very advanced. They're what we call pod systems. And so the Juul device has these pods that you put in the device and then you vape. Each pod has as much nicotine as a pack of cigarettes. And so that's really the third main evolution in e-cigarettes, is that this actual liquid has changed quite a big deal. And one of the ways that it's changed is that it contains nicotine salts. And so the e-liquid, which comes in candy flavors, like this Candy King, which certainly looks like Sour Patch Kids, they're able to put a very high amount of nicotine. And what that does, particularly with our youth, is it is the potential for higher levels of addiction. The Food and Drug Administration, the FDA, has regulatory authority over tobacco products. They do have regulatory authority with something called the deeming rule that was implemented in 2016. 5.3 million high school and middle school students who are using e-cigarettes. Many of those students would have never picked up a conventional cigarette. In adults that are trying to quit using cigarettes, unfortunately, the studies are showing that in normal situations, they are more likely to use both the e-cigarette and the regular cigarette. So they're known as dual users. So instead of being able to quit cigarettes, they end up just picking up e-cigarettes on top of that. So a meta-analysis by Stanton Glantz shows that cigarette users who use e-cigarettes to quit are actually less likely to quit cigarettes. In fact, what happens is that e-cigarettes potentiate, or they continue, that nicotine addiction.
Let's move on a little bit and talk about vaping and tobacco and COVID-19.
There's been a recent meta-analysis, so it's basically a summary of 19 different studies that looked at patients who had COVID-19 and that also had that a history was taken of their smoking status. And what they found is that smokers were twice as likely, with an odds ratio of 1.9, so almost twice as likely of developing severe COVID-19 symptoms.
While we haven't seen as many teenagers actually contracting the disease, they seem to be less likely to social distance. They're more likely to be picking up bad habits like vaping. What kind of a public health message needs to go out to that population?
We know that 27% of high school students from 2019 data from the National Youth Tobacco Survey are current users of e-cigarettes. And with this pandemic, we don't know what direction that's going to take. We know that number has risen astronomically since the National Youth Tobacco Survey started surveying for e-cigarettes in 2011. With social isolation and anxiety and stress, certainly pediatricians like myself worry that number, there might be an increase in students, using vape products or, other tobacco products.
That brings up an interesting point, because if adults are vaping or smoking near children, does that create more of a problem for the children if they get COVID-19 for their heart and lungs and, just general respiratory health?
That is absolutely a great question. And, at this point, we have basically no data on secondhand smoke and the effects on children related to COVID-19. What we can say, though, is that secondhand smoke is a big risk factor for childhood illnesses. We know that secondhand smoke increases the rate of sudden infant death syndrome, SIDS, or crib death. We know that it increases ear infections, pneumonia, asthma, as well as worse asthma attacks. and bronchiolitis, which is another disease, another illness that's caused by different viruses. So, I think it's very safe to say that secondhand smoke is bad for developing lungs, for childhood lungs and adult lungs. But we can't say what secondhand smoke or secondhand vape is doing in terms of COVID-19.
That's it for this edition. Please follow us on social media and go to our PBS website at pbs.org/to the contrary. And whether you agree or think to the contrary, please join us next week.
Funding for To the Contrary provided by the E. Rhodes and Leona B. Carpenter Foundation, the Colcom Foundation, and the Charles A. Freoff Foundation. For a transcript or to see an online version of this episode of To the Contrary, please visit our PBS website at pbs.org/to the contrary.
Be more. PBS.